hard for a young man with cancer to imagine if he even wants to be a father later. Sometimes the parents are more worried about having grandchildren than he is about banking sperm. So a challenge for us as healthcare providers is to help the family talk together and decide what's best for everybody. And we often find that it's easiest for boys to talk separately from their parents, since many of them have never talked much about sex to their parents, and especially about the difficult topic of masturbation, which is a very harmless kind of sexual activity as far as doctors and psychologists are concerned, but is banned by many traditional religions. And it's hard because at that age, a teenager, boy or girl, feels very dependent on parents for their cancer care decision. So sometimes we have to talk to parents and boys and then help them get together and make a decision. And reaching orgasm may be the most private event that was ever included as a medical procedure, worse than giving a stool or a urine sample. And so going to the sperm bank can be difficult for boys, and we often give them some advice on how to maybe collect a sample at home and get it to the sperm bank within an hour. There are also mail-in kits. There are some special ways to help collect sperm if boys are having trouble giving a sample because they're sick and they aren't used to masturbation, and it's hard to get sexually aroused in that situation, but those are more invasive and we keep them as backups. Now, unfortunately for girls, nothing is as inexpensive as sperm banking. Now, to bank an ejaculation and store it for 5 years might cost $400 or $500. But for girls, going through an IVF cycle or having a laparoscopy surgery to collect ovarian tissue, those things can often be $6,000, $10,000, again with minimal insurance coverage. So that makes it very unfair. Some organizations like Fertile Hope, which is now part of the Lance Armstrong Foundation, have some funds for cancer patients to support some of these procedures or to help pay for infertility treatment later on. And so it may delay cancer treatment. There is one treatment that's been proposed a lot to girls, which is to give them a drug like Lupron that puts them into a temporary menopause during their chemo or their radiation. And unfortunately, we're finding now that that probably is not a very effective way of preserving their fertility. We used to think that the ovaries were very quiet places before puberty, but now we know that all the time the ovaries are ripening eggs, and it's just that the eggs don't become fully ripe until puberty adds some extra hormones for a woman. So her ovaries aren't a quiet place, and the number of eggs left in a woman's ovary that can be ripened and ovulate in the future are called her ovarian reserve. And we have some newer tests now to try to estimate how much fertility a woman has left. You can test for a special hormone called AMH, or anti-Müllerian hormone, that tells you a little bit about how many of these undeveloped eggs are left in the ovary. Or you can do an ultrasound of the ovary and see how big it is. And if a woman's having menstrual cycles, you can do that towards the time in her cycle when she would ovulate and see how many of the follicles are growing, and they're called antral follicles. And ultimately, one of them gets selected to grow to the point of ripeness and produce an egg. But unfortunately, we need some age standards for these tests to be able to predict for an individual woman what they really mean. We may be able to use them to give her some idea. One option may be to transplant some ovarian tissue back to a woman's own body, but for some types of cancers, especially blood-borne or lymph node cancers, a concern is that that tissue could have some cancer cells in it. So you don't want to freeze that tissue and then put it back in the woman's body and possibly, although the chances are small, but to take any chance of having her then have a recurrence of her cancer. Also, when you remove some of this tissue, especially in a very young child, you're removing some of the tissue that may be responsible for fertility later on. So what are the risks and what are the benefits? How do you decide whether to remove tissue? Now, in the U.S., we're considered kind of a cowboy country by Europe because we have so few laws that actually govern things like egg and sperm donation or entering into a contract with a woman to carry a pregnancy for another woman. But for cancer survivors, that's a good thing because we do have a lot of freedom, and you just have to really be very aware of the laws in the state where you live, where anybody who's helping you with the pregnancy lives, and often it's really important to consult an attorney who specializes in some of these things. Again, the downside is the expense. It's pretty cheap to buy donated sperm from a donor, but all the things that are available to women, getting donated eggs, having someone carry a pregnancy, are quite expensive unless you have a family member like a mother or a cousin or who can do some of these things for you. More young cancer survivors are comfortable with the idea of adopting a child than having a child through third-party reproduction. But adopting a child isn't easy either for anyone, whether it's a Caucasian or a minority infant. The wait to get a healthy infant is often long and expensive. And for survivors, there's the additional barrier that some international countries will not give a child to a cancer survivor or want a letter from the oncologist saying that the survivor has a normal lifespan expectancy. And domestic adoptions now are often done by people meeting over the internet or through an attorney and the birth mother picking the family. And some young birth mothers may be scared away by the thought that one of the people in the couple has had cancer. And there are certainly hundreds of thousands of children in foster care who really need good homes, but they often come with special needs, medical and emotional, and a young survivor may have a lot of empathy with that, but on the other hand may also have medical bills and limited income to make it more difficult to adopt a special needs child. So there is a really excellent discussion group on yahoo.com called Adoption After Cancer, and I would really urge anyone interested in that to go online and look at their archives and join that discussion group because it's really got a wealth of information. I would just say that many young women are scared that being pregnant after cancer will make their cancer come back. And even for breast cancer, there's no good evidence that that occurs. However, one thing that women often aren't aware of is, as Dr. Franklin was saying, you may have some subtle damage to your heart or your lungs that isn't affecting your daily life. But under the stress of a pregnancy, that damage could cause complications for the mother and the baby. So I think that a young cancer survivor who's thinking about getting pregnant should routinely see a high-risk obstetrician and get their heart and lungs checked out. And also, if they've had any radiation to the pelvis, especially at a young age, if it could have affected their uterus, that's important, because if the uterus doesn't grow to full size or has less blood supply after radiation, that can create a risk for a miscarriage or for stillbirth or a low birth weight baby. But on the other hand, many, many young women do have children after cancer successfully. And the other good news is that those children are healthy, and the only connection that's been seen is in those few families, which are usually about 10% or less, that have an inherited cancer syndrome. Those children, of course, would inherit the risk of the parent, and they have usually a 50-50 chance of inheriting a mutated gene. But otherwise, there is no unusual risk of cancer to those children in their lifetimes and no unusual risk of birth defects that have been found. So what we hope is that more and more programs for young adults are going to be able to have infertility specialists that are a part of the treatment team, can offer fertility preservation at the time of cancer, and can also consult with young survivors afterwards. And although we haven't quite reached that point, we're working on it, and there are a number of fertility programs in Houston that have specialists that are very interested in seeing cancer patients and survivors. So let me stop there.